Welcome to this deep dive. Today, we're looking into Ozempic, which, well, it's been everywhere lately.
It really has.
And we want to explore how it fundamentally works inside your body.
Exactly. We're going to focus on the mechanisms, specifically these hormones called GLP-1s.
GLP-1s. Okay.
Yeah. The idea is to give you a really solid grasp of what they do, not just for diabetes and weight loss, which is what most people know, but maybe touch on where things could be heading too.
Right. So GLP-1s then, let's start there. What are they actually doing normally? What's their job?
Okay, so GLP-1 stands for glucagon-like peptide 1. It's part of a family called incretin hormones.
Incretins.
Yeah, your gut releases them after you eat a meal.
Oh.
And they're crucial for managing blood sugar. The really fascinating part is how GLP-1 tells the pancreas to release insulin.
Uh-huh.
But, and this is important, it does it in a glucose-dependent way.
Glucose dependent, meaning like it only really ramps up insulin when blood sugar is actually high?
Precisely. So when you eat and your blood sugar starts to rise, GLP-1 kicks in and says, okay, pancreas, time for some insulin. But if your sugar is normal or low, it doesn't push for more insulin.
Ah, so that helps prevent hypoglycemia, low blood sugar crashes. That sounds like a big advantage over some older drugs.
It definitely is. And there's another piece too. GLP-1 also tells the body to release less glucagon.
Glucagon, that's the hormone that raises blood sugar, isn't it?
Exactly. So GLP-1 is kind of working both ends, boosting insulin when needed, and suppressing glucagon. It's all about balance.
Okay, that makes its role in diabetes pretty clear. But what about the weight loss side? That's really put Ozempic on the map.
Right. Well, GLP-1 has other effects. It slows down what we call gastric emptying, basically how quickly food moves out of your stomach.
So you feel full for longer after eating.
You got it. That feeling of satiety lasts longer. Plus, there are GLP-1 receptors in the brain.
Oh, interesting.
Yeah, activating those seems to directly reduce appetite signals and just, overall food intake. It hits appetite from a couple of angles.
So it's influencing blood sugar via insulin and glucagon and appetite through the gut and the brain. Quite a multitasker.
It really is.
Okay, so knowing what natural GLP-1 does, how does a drug like Ozempic actually use that system?
Well, Ozempic is what we call a GLP-1 receptor agonist.
Agonist, meaning it activates the same receptors.
Exactly. It mimics what your own GLP-1 does. But here's the crucial bit. It's engineered to stick around much, much longer.
Yeah.
Your natural GLP-1 gets broken down really quickly by enzymes in the body, like within minutes. Ozempic is designed to resist that breakdown, so it stays active for days, providing a sustained effect.
So you're basically getting a longer-lasting, more potent version of that natural signal for blood sugar control and appetite reduction.
That's a good way to put it, yeah.
And you mentioned earlier potential uses beyond just diabetes and weight loss. Where else might this pathway be important?
Right, so this is where it gets really intriguing. Though still early days, mind you. Researchers are looking into the broader effects of GLP-1 signaling.
Just
Well, for instance, there's some initial research exploring if GLP-1 agonists might impact neuroinflammation.
neuroinflammation.
Yes.
Like in the brain. What kind of conditions?
Things linked to certain neurodegenerative diseases. Again, it's preliminary, but it hints that GLP-1 might have roles far beyond metabolism. There's also ongoing work looking at potential cardiovascular benefits.
Wow. Okay. So quite a bit more complex than just a diet drug.
Definitely.
So let's bring it back for everyone listening. What's the main thing to understand here?
I think the core idea is that these medications, like Ozempic, work by essentially hijacking, or maybe better said, enhancing a natural system your body already has.
Right. It's tapping into that GLP-1 pathway.
Exactly. It leverages that combined effect on blood sugar balance and appetite regulation that natural GLP-1 provides.
And the fact that it lasts longer is key to its therapeutic use.
That's the engineering breakthrough, yes.
Yes.
And as we said, the ongoing research might reveal even more applications for activating this pathway in the future. It's a really active area.
So as you hear more about GLP-1 drugs, it's worth remembering this underlying biology, how they interact with your body's own intricate systems.
It's quite elegant, really.
It is. And it leaves you wondering, if this one pathway has these diverse effects, what other hormonal systems might hold keys to treating complex conditions in the